So we got a patient, 23-year-old female runner, who's come up with chronic 4-month history of shin pain. The pain, as per the AIDS criteria, is on the posteromedial aspect of the tibia. I'm not concerned of any stress fractures. There is no night pain or resting pain. The pain is reproduced on palpation, so that's where exactly the patient gets the pain, sort of 3 to 5 centimeters. So history of running-related pain. Pain on palpation and spreading around to 3 to 5. So she fulfills the criteria for the AIDS criteria for diagnosis of MTSs. For the first part, I'm going to look into giving a bit of treatment around the muscles, because it can be too sore if you go straight onto the bone. So I'm going to use radial shockwave to sort of desensitize the muscles around it, working on the tip post, and then I'll be going exactly onto the bone, and we know that shockwave works really well for bone remodeling. So let's start with radial shockwave, which we're going to look into. So I won't be going on the bone, but mainly working on the sides here. I'll be aiming for at least 1,000 impulses. Okay, so once you've done around 1,000 impulses with the radial, sort of that desensitizes the region here. So I'm going to look into getting directly into the most painful region, which is posteromedial tibia. So can be extremely painful, so it's really important that you focus on the right region. So I'm going to use focus shockwave, which is designed for bone stress injuries. So I'm going to follow the Mons protocol, which is 0.10 for the first session, and start with 1,000 to 1,500 impulses. And it's really important that we keep the treatment head exactly at the where area of pain. So it's quite different from the radial, where you move on a lot. So you just move on a little bit, covering all the key areas, and always checking with the patient. Is this your pain?
Yes.
So that's really important that you check with the patient. It's a small area, around 3 to 4 centimeters. So, and then you might start with 0.05 and then slowly working up, back and then behind. Obviously, if they're getting any sharp pain, pins and needles, you can always change that. Focus shockwave is usually well tolerated by most patients, because you don't get a lot of energy wasted on the skin and superficial region. If it's very sore, I might restrict my impulses to just 1,000. If not, I might increase it to 1,500. And like with all treatment, you're allowed to have as much breaks as you need during the treatment. So we're giving sort of starting from 0.05 to 0.1, and the next session I'm going to sort of increase it depending on the response. So the treatment is normally 1 session per week for 3 sessions. In very chronic cases, you might need to do it about 5 to 6. Good. So that completes the treatment with the focus. So I'm going to finish off with some V-actor treatment, which is looking into the muscles and fascia, and also give a bit of pain relief around the structure. So we've done the radial, we have done on the bone, and we're going to finish off with some V-actor. Good. So that concludes the treatment for focus shockwave on medial tibial stress syndrome, otherwise known as shin splints.